Our goals in being here today are really to sort of talk through the intersection between domestic violence and HIV. I'm hoping that we'll really also be thinking about coming up with some ideas around how do we talk about HIV with survivors. And then again, I think we're always in our work thinking about how do we connect with other people who may be working with folks living with HIV and may also be encountering people who are experiencing domestic violence. In terms of trying to get kind of everybody on the same page, I'm going to just play a really quick video that gives us just some basics around HIV. I know that there are different people at different spots in this work. So I want us to just understand and have one sort of baseline definition. So this is just a quick, less than 2-minute kind of video to kind of root us in our knowledge about what we're talking about when we're thinking about HIV.
HIV stands for Human Immunodeficiency Virus. It works by attacking the immune system, the very thing that stops us getting sick. HIV targets CD4 T cells in the immune system, cells which usually coordinate our body's immune response. The virus takes over these cells and uses them to make copies of itself. Over time, HIV kills more and more of these CD4 cells, weakening the body's immune system and its ability to recognize and fight infections. If HIV isn't controlled by treatment, eventually the body becomes unable to fight off serious opportunistic infections, including tuberculosis, leukemia, pneumonia, and Kaposi sarcoma. It's these opportunistic infections that can cause death. Many people confuse HIV and AIDS. HIV is the virus that attacks the immune system. AIDS is a set of symptoms and illnesses that are a result of an immune system seriously damaged by HIV. AIDS is now more commonly called late-stage HIV. There's no cure for HIV, but antiretroviral treatment stops the virus from replicating and damaging the immune system. A person living with HIV who's on effective treatment can live a long and healthy life and never progress to late-stage HIV.
Okay, so in order for us to really be thinking about the intersections of domestic violence and HIV, there's just a couple of medications that have some acronyms. We just heard one of them in the video. And so before we get any further, I wanted to spend a little bit of time just kind of talking about what these are. And again, for some of you, this may be a review. So for anybody who has knowledge or information around these, I'll tell you a little bit about them on the next couple of slides. Medications that are related to HIV, PrEP, a lot of people have heard about PrEP. It's something that definitely, like, I know I see a lot of commercials for it. And that's pre-exposure prophylaxis. PEP, post-exposure, and ARTs, which are antiretroviral therapy medications. These are things that we really want to know about because when having conversations with survivors, especially about HIV, we're not asking people, or nobody should ever be asked their HIV status, but a survivor may be saying like, yeah, I take PrEP or I'm on an ART. There are also things that survivors may need, like they may need help obtaining, and they may be telling you about them. So we just want to make sure that everybody's sort of aware of what they are. So when we're talking about PrEP, the purpose of PrEP is that it prevents people from developing HIV. It's a medication that comes with a prescription and it has to be taken daily, which we'll talk about in a little bit, why it can feel challenging for survivors. It requires a checkup every 3 months by a medical professional, and people must be HIV negative in order to take PrEP. PrEP is often intended for people who are at a risk of contracting HIV. Maybe they have a partner who's a person who's living with HIV. Maybe there's someone who uses substances Maybe there's someone who is in a profession where they're concerned. I don't know that there's a ton of professions where people may take PrEP, but again, it's a medication that is meant to prevent people from developing HIV, but it does have a lot of requirements that come with it. Again, making sure that it's something that's daily. You have to see a provider every 3 months. You have to be HIV negative in order to continue to take PrEP. And then PEP is something that I knew when I was at a domestic and sexual violence program. I would hear about PEP sometimes, especially as it would relate to someone maybe getting medications after a sexual assault. And also I knew that it was something that we had some policies around, like if there was the potential for an exposure. So PEP is not intended to be something that someone would take every single day. It's supposed to be taken up to 72 hours after a possible exposure to HIV. It's meant for people whose exposure is pretty infrequent. So for example, if there was a medical provider who got a needle stick and there was the possibility that as a result of that needle stick, the HIV could have been transmitted, they are probably someone who's going to take PEP. It must be prescribed. Typically, the main prescribers of PEP are like primary care providers and also ER doctors. And follow-up testing is really encouraged. It's important to be mindful of the fact that if someone has contracted HIV, it doesn't necessarily show up right away. So really that's part of that reason around like that sort of recommended 3-month testing. So if someone took PEP, the sooner the better, but there's also a lot of follow-up testing that's encouraged. Because like any medication, right, it's not a cure-all, it's not a guarantee, and we want to make sure that people have access to those things. And then antiretroviral therapies, or ARTs, are taken by people living with HIV. And what ARTs does as a medication is it works by stopping HIV from making copies of itself. So we saw in the video sort of the little photocopy, and it's important too that they're taken like sort of as prescribed. When we think about people living with HIV, so we've kind of talked through the medications, but in Pennsylvania and in a number of states, really, there are some aspects of HIV are criminalized. And I know that there's a lot of work and a lot of legislation and a lot of policy work at the national level and somewhat at the state level around making sure that people living with HIV aren't criminalized because of their status. But it's important to be mindful, and when we're thinking about survivors, that we are aware that we can't ever promise that someone's status either won't be known by others or that the disclosure doesn't pose danger in the civil or criminal systems. Now, there's 2 specific things that I just want to address. And the first is increased legal penalties for some offenses when someone has HIV. So there are 2 types of things that result in increased legal penalties. So for folks that are engaged in sex work and for people who are incarcerated, depending on the types of offenses they're charged with, if they have HIV, those offenses can be upgraded from a misdemeanor to a felony, or the felony charges can be upgraded. And we often know that survivors of domestic violence are often incarcerated, sometimes as a result of that violence, sometimes as a result of the behaviors that their abusers engage in. We know also that there's a lot of intersections between sex work and people experiencing domestic violence. So we want to be mindful of that. And then the other concern related to sort of laws about people living with HIV is that there are mandatory reporting requirements of positive test results. And I think we're all probably aware when it comes to healthcare and domestic violence that there's a lot of intersections and a lot of spaces where there's surveillance of certain types of test results. So if there's a positive HIV test result and it's the test is done in any type of sort of like healthcare environment, that information has got to be reported back to the Department of Health. And that occurs even when a viral load is considered undetectable. Are any of you thinking like kind of getting those moments of going like, this could be bad or dangerous for survivors? And if so, why might mandatory reporting requirements of positive test results be something we would want to worry about or be aware of for DV survivors. So survivors fear that info will be shared with their partner and it could prevent them from seeking testing. Yep, that's great. So the question is like, is this public knowledge? And for most of the situations, Susan, I mean, I think for some people it is, but I think sometimes when we enter into health environments and we're engaging in testing, what are we doing? We're just like sign. So I think it can't hurt us to know this as people who do advocacy work to prepare survivors. But there's a couple of solutions that we'll talk about in a little bit, including doing some testing at home or like an at-home testing kit that we'll get to a little bit after the break. So I think that to that point, if it's not public knowledge, it could be really challenging. And also, if there's mandatory reporting requirements, that also can mean that people's partners become aware of those results, or they're encouraged to talk to partners about their results. And that may even include like former partners. So this can be something that can kind of like open people up to sometimes having to be in positions that don't necessarily feel safe for survivors because of those things related to surveillance. And we'll talk more about that, but just helpful to know that people living with HIV sometimes can face additional penalties and also mandatory requirements. It's also important to note that like, even if a viral load is considered undetectable, so that means that like, there's a lot of information that may be circulating about folks that they may not even know where that information is landing. In terms of thinking about people living with HIV and domestic violence, and I think this is one of those things, right? Like depending on how, kind of what your role is, these are probably not things that are necessarily like shocking, but a lot of DV survivors are more likely to be exposed to HIV than people who have not experienced abuse. Any ideas on why that might be? Why are DV survivors more likely to be exposed to HIV than people who have not experienced abuse? Oh, you guys are really having some great answers. People experiencing abuse have less agency in their choices. Many people contracting it through sexual abuse. Due to abuse, they might not feel safe asking for condoms to be used, for example. Their abuser is less likely to use protection and is more likely to have more than one partner. Those are absolutely the core key answers. And we know that, I know that sometimes like, there's so many intersections in our work with other things, but we also know that if there's a person who's living with HIV, they can sometimes use their status as a way to say like, listen, you have to stay with me. I need care. And they also may be kind of coming back and saying things that make people feel, again, like they can't negotiate around safe sex practices. They may withhold things related to PrEP. So if an abuser is a person who's living with HIV and they refuse to let their partner get access to medication, like PrEP, that's another way that can happen. And people living with HIV are twice as likely to experience domestic violence than people who are not. And these are kind of core pieces of information around why we want to be mindful and aware of it's really challenging for people living with HIV sometimes to necessarily like, they may not have ever thought like, oh yeah, maybe I want to talk to a domestic violence advocate or a program. And a lot of organizations that may help people living with HIV are focusing in on making sure that people get like access to medications, that they have what they need. And sometimes a partnership with a DV organization could be really crucial and really helpful. And when we know that people living with HIV are twice as likely to experience domestic violence than people who aren't, there's a slew of reasons, right, why that might be. And we just want to kind of be thinking about and really mindfully working on what are some strategies that we could be using to address this. I wanted to ask you all, what are some coercive tactics related to HIV that abusers might use? So just take like a couple of minutes and type and drop some of them into the chat. Just to make sure everybody has time, I will not talk for the next minute and a half. So what are some coercive tactics related to HIV that abusers might use? Amazing answers in the chat. So we are seeing things like someone threatening to disclose HIV status if a survivor leaves. Another tactic might be a couple of folks said outing a person for having HIV, controlling them by making threats. So, if you don't do this, I'll tell everyone that you gave me HIV. Maybe one partner has insurance that the survivor is using and threatens to remove them, and they might fear not being able to get their medications. It's a great response. Threatening to keep, steal, withhold medications. That is like one of the number one things that I have heard about from folks living with HIV who have experienced domestic violence is that control around medication and the control around access to getting care. Think about this, right? And so there's a stat that's floating around. It's like, that 44% of people that are living with HIV and experiencing domestic violence have a hard time taking PrEP or taking antiretrovirals. And if we think about why that might be, right? Like if you're on PrEP, right? So you are considered at risk for developing HIV, you're taking PrEP. Remember, you have to see that doctor every 3 months. You have to test negative. There's a lot of requirements, right, that are going into making sure that that medication is getting to you, and that it can easily be withheld by someone. I'm seeing things too in the chat that really, I feel like are honing in on the fact that a lot of abusers really rely on the stigma of someone being a person living with HIV. There's a really cool project that comes from the National Network to End Domestic Violence. They have this incredibly cool program called the Positively Safe Project. They've recently sort of revamped their training. I was part of a cohort earlier this year to really I was lucky enough to be one of the first folks to sort of see this revamped training. They have an HIV power and control wheel. I will put it into the chat during our break, but it really kind of hones in on, and it's a great tool like all of the power and control wheels that we use to really identify some of those things that we have been kind of getting to and thinking about and talking through, especially that medical abuse component. And again, like that idea of like withholding things and making sure that the stigma around people living with HIV is something that people who are abusive will really try to leverage. I have another video that I'd really like to show, and I'm hopeful after we're watching this video, and this video is really linked to thinking and talking through sort of the history of HIV, the history of how, what the video calls the AIDS epidemic, but it also really talks a little about the stigma. And so I'm hopeful as you're watching that you may be thinking about how does the stigma of HIV plus experiencing DV, what's sort of the impact that has on survivors? This is a slightly longer video. I think it's about 7 minutes. I really encourage you while you're watching to please take care of yourselves. I will say Dr. Fauci is in this video, a younger Dr. Fauci than what we've been seeing around the pandemic. So just to keep on the lookout, if he is your favorite doctor to see on TV, you'll have a chance to see him here. So we'll just kind of watch this again. Take care of yourselves. This is a lot of information, and again, really related to a lot of stigma. And then we'll come back, we'll do a little bit of reflection, and we'll talk a little bit about the video. And again, we're really thinking about the stigma of HIV plus experiencing domestic violence and how that may impact survivors and how they seek out help and assistance and support for experiencing DV.
When the first report from the CDC's Morbidity and Mortality Weekly Report reported a very curious situation of 5 men, all gay, from Los Angeles, who were presenting with an unusual pneumonia. It was at that point, 40 years ago, where I can tell you chills went up and down my spine. Being an infectious disease person, I said, oh my goodness, this has to be a brand new infection.
These young men often were in hospitals. We would see them in hospitals very ill, and they had been completely rejected by their families. Sometimes we would call parents and tell parents at the same time that their son was gay and had perished from HIV.
There were no laws protecting people with HIV. So someone could be fired from their job, kicked out of their place of residence, and be on the street within 24 hours of people finding out they were positive.
We're considered miscreants and we're considered uber promiscuous. So it's always a moral Olympics when it comes to Black women in HIV. It's almost as if we did something to warrant getting this diagnosis.
When I began taking care of patients starting in 1981-82, virtually all of my patients died.
This is a very puzzling syndrome, and scientists like myself and others of my colleagues are taking different approaches.
We didn't know what it was, so it was a disease, mysterious, no name yet.
We had only heard one instance when my partner became extremely ill, was on 104 temperature, and we rushed him to the hospital. I had no idea that once they took him back, I would never see him again. Unfortunately, 7 months later, I started running a bad fever. I was originally diagnosed in San Francisco on February the 14th, 1982. So I've been living with the HIV virus at least 39 years, getting ready to hit my 40th year.
One of the things that became very clear is that when you're dealing with a brand new outbreak, an evolving pandemic, that you learn things in real time. It was just literally a matter of several months as you saw injection drug users, hemophiliacs, recipients of blood transfusions, the female sexual partners of men who had this disease, and then finally children born of women who were likely infected.
For anyone out there that has never been in quarantine, it is one of the most lonely, dehumanizing, scary places to be. And I wouldn't wish it on my worst enemy. When I miraculously started getting better, it was about 10 days later. I had a guilt trip for a long time of why I was outliving everyone. It's called survivor's guilt.
You know, the biggest turning point truly was 1996, because that was when we had enough highly active HIV medications that you could put together that you could actually really combat the virus and get the viral load in the body from HIV down to undetectable levels.
We gradually, over a period of years, developed 1, 2, 3, 4, 5, then a combination of highly potent antiretroviral drugs that have literally transformed the lives of persons with HIV.
My name is Lydia Joyce, and I have been living and thriving with the HIV diagnosis for going on, it'll be 5 years in September. The night that I got home, I kept Googling, I'm HIV positive, now what? Like, that was a phrase, I kept Googling, and everything I got was very white, very male, and very gay. As a Black, cisgendered, heterosexual woman diagnosed with HIV, it can be very ostracizing. It can be very polarizing. Your self-worth is attacked. The external stigma then becomes internalized.
When there is discrimination, when there is stigma, it is harder to access services. It's harder to go to a medical center and say, I am gay and I need prevention services. It is more difficult for you to come out with your family, for your family to help support you. So it really is stigma, discrimination, and susceptibility to a pathogen have always gone hand in hand.
Even though we want to say things have progressed within HIV over the last 40 years, there's so many things that have not progressed. You know, the connection to care, the myths, the stereotypes, the stigma, the cost of the medication, the intersectionality of being HIV positive, making sure people have, you know, housing and food, and the same things that they probably were dealing with in the 80s, especially when it comes to minority communities, we're still yet dealing with.
I think the highly productive activism, mostly of the gay community, brought attention to the fact that when you have a disease that appears to be affecting disproportionately a population of people, in this case it was men who have sex with men, that you've got to give them a seat at the table.
I knew I had to speak up, that I couldn't count on someone else doing it, because I was either the first or one of the very first people to get out of the hospital in San Francisco. And if I didn't speak up, then who was going to?
We marched in the streets, we held rallies at state capitals and on DC, we chained ourselves to buildings.
So for 39 years, I've been fighting for something.
In the fall and winter of 1981, there was only a few hundred cases reported in the United States, and now fast forward 40 years, there have been a total of over 75 million cases worldwide and over 35 million deaths.
Though HIV progress has seemed very quick, in at least over the 40-year span, what we did with COVID-19 in a space of just 7 months, develop highly effective COVID-19 vaccines, to me means that HIV is still a stigmatized condition. And that the rapid progress with COVID-19 needs to be translated into better work on an HIV vaccine.
If we got through and processed what stereotypes and stigmas and myths that people really had, implicit biases, we really could help further the messaging about us really stopping HIV in our lifetime, because it's possible.
This was sort of the reflection question. This video, I think I love it because it addresses the stigma and uncertainty for people living with HIV. So you can kind of drop in the chat sort of what your reflections are around the video, but also where are the intersections and how does the stigma, the sort of marginalization that we're hearing about in the video, how does that also impact people who are experiencing DV and maybe never hearing or never having conversations about HIV? So again, I will be quiet for 90 seconds while you type your reflections into the chat. So some of the things that I'm seeing in the chat are that it would be a feeling of like utter helplessness and depression, concerns that like the sort of like stigma on top of stigma on top of stigma may make someone feel like they might not find somebody else to love them, increased isolation if outed, a loss of self-worth. Someone expressed that they don't think the stigma has changed that much since HIV was originally discovered. And for DV survivors, right, so there's this added layer of guilt, shame, and fear. And to the person who put that in the chat, I absolutely agree, right? There's so much stigma continuing to surround HIV. I love that Ladea in the video is wearing a shirt that says being positive isn't negative. And when we come back from break, we'll kind of come back and we really want to be focusing through the lens of sort of being aware of the stigma, but not reinforcing it. Someone put in the chat a fear of excommunication from church groups or groups of communities of faith, fear of having to disclose status to a new partner. And then someone also says, learning that scientists contribute the absence of an HIV vaccine to stigma based on how a COVID vaccine was developed in 7 months is very eye-opening and reminiscent of how marginalized survivors of DV are often dismissed as well. Thanks for putting your thoughts in the chat. Remember, if there's something that comes up for you in a little bit, you can absolutely continue to put information in. So what we're going to do is we're going to take a kind of a quick break. I think that we'll come back from break to be thinking about and being mindful of who and how, what can we be doing with survivors to decrease stigma, increase access, and also who can we be partnering with to make sure that DV survivors have access and opportunities to have questions answered about HIV, but also how we can be supporting survivors who may be people living with HIV and how we can be supporting organizations that work with people who are living with HIV to understand and ask some questions about domestic violence. So again, like really a lot of what we think about doing in our work is as we, like we've just been sort of having some conversations about HIV. We're thinking about working with survivors, obviously, because that's the work we do. I was just wondering if any of you are thinking just after our time together, or even before our time together, before we move into talking about this, are any of you willing to share anything you're thinking about incorporating information about HIV into your work? Or if you already do incorporate HIV information into your work, what does that look like? I see some great answers in here. So starting, just again, just thinking, starting or referring people living with HIV to support groups could be beneficial. Making information available through posters and brochures, referrals to free or low-cost clinics for medications is important. And survivors with HIV can also have other resources to benefit them, right? Like there are a lot of other programs and even things like relating to housing and medications and stuff like that we'll touch on a little bit, but that again, reaching out to the folks that you may reach out to as a result of being a part of today's training, maybe those are great opportunities to develop some collaboration to build support. And then someone else mentioned working with community or HIV clinics to screen for DV. I love that. Making people aware that medication can prevent catching or spreading HIV. Yeah, and there's some great resources. So I want to make sure that we have time to share that. And I think what's so important too is just being mindful of the fact that for some survivors, they might not have thought about HIV with the many other things that are going on and all of the trauma in their lives. So just having this information kind of like out and available in ways that are, like not gatekeeping. So, maybe I love like posters, information, like, hey, there's this thing, normalizing the discussion, talking about it, and making sure that the information's available to everyone. So the same things that we encourage healthcare providers to do about having information about domestic and intimate partner violence available kind of all over the place. It can be things that we can do within our work environments and within our organizations. And then again, just that sense of, like you've already sort of mentioned, having information easily available. Again, about medications, knowledge, information. Again, that sort of follow-up from the National Network to End Domestic Violence has a couple of thoughts that I think aren't going to be shocking for us, but I think are helpful to have in the back of our heads as we're thinking about potentially starting some conversations. I love that. Making sure signage around your building is positive and inclusive, right? So we don't want to get something like that's stigmatizing. Again, thinking back to like being positive isn't negative, Ms. LaJoyce's thing on her t-shirt, right? And that slogan, we want to encourage people to know, like, hey, there are options, there are resources. We want to make sure that people are aware of it. And again, connecting with folks who, we don't want to do the same thing and sort of the same stigma that a lot of our survivors may have encountered in other areas. So we want to be thinking about doing things that are strengths based. We want to be culturally resonant and humble. We want to have information about options and resources, and we want to really talk through privacy and confidentiality. And that's one of those spaces where figuring out and finding the resources. And I have a couple of ideas around like some starting places within communities and people who may know a little bit more about privacy and confidentiality when it comes to testing or seeking services. Because again, what we always want with our survivors, right, is to make sure that they are at the center of the decision-making process so that they have all of the information and all of the pieces they need in order to make informed decisions that are best for them and best for their lives. And again, like, it's sometimes I think like I use the word like conversations, but again, it's just about having this information really available. And it's that, it doesn't just fall with one person within your organization, that everybody has information and can refer someone or can just like talk about this particular topic, because it is so prevalent and it is something that I think sometimes can feel hard to talk about because we don't always have all of the pieces of information that we might need. So we just normalizing and learning what we can do. I am so excited to talk about this with you all. And I think a lot of people are familiar with this, but you can get like kind of at home, and I put that in parentheses, HIV testing, because It doesn't actually have to be sent to your home address. The great people at getmyhivtest.com are absolutely willing to send an at-home HIV test to an office, to a family member's address. I had reached out and said, like, hey, we have, like there was a program and they had, like there was going to a PO box. Would they be okay with that? And they were really open to hearing that conversation. So if you want to have some of those conversations with the great folks at getmyhivtest.com, please do so. I don't know if anybody on the call is working with folks in Philly, but Philly has a different mechanism. So it's Philly Keep On Loving. And that's sort of the same concept, right? That you don't have to go to the Department of Health. You don't have to go to a provider. And I'll show you in just one second what the testing entails. It's super simple, but I was wondering if you may be willing to just drop in the chat. You know what? That's a good question. I'm pretty confident that the packaging is pretty discreet. I will say I'm happy to order one and let you know what it looks like. But these folks really do seem to want to make sure that nobody is stigmatized. So I think that's a great question. I didn't think about that. So I will absolutely let you all know. And I am curious, what are the benefits for sort of like at-home testing or testing that's done outside of a doctor's office, especially for survivors? Are there any benefits that are coming to your minds? It's a great question. Easily accessible, it's confidential, it's a more comfortable environment. And also remember, yep, I think that's a great response. Someone said the doctor won't call to report results. It doesn't require transportation, and people are able to get some information without it maybe being part of so much of that surveillance process, less of a chance of discrimination. You guys are super smart. Thank you so much. So I have one more video, and I love this video because it shows folks how the test works. And what I just want to say about this video is this would be something that if you wanted to, like, you could have a copy of this video. If this was something someone was thinking like, oh, I'm not really sure, I'm a little bit nervous about this, this could help people understand maybe what they could expect if they got this test. And I will let this play. And so let me know what you think of it when we're done. And then we'll come back and we'll talk a little bit about some resources for folks to get PrEP, to find some HIV services, and then also who you could be maybe contacting in your local area. So we will watch them talk about this at-home test. And again, if you're watching and you want to just be dropping your thoughts into the chat, that's great too.
It's important to know your HIV status so you can choose options to keep yourself and your partners healthy.
Now it's easier than ever to get tested from wherever you are.
I know that a whole lot is going on in the world, but knowing your status means that you have power. You have power to take care of yourself. You can make better decisions about your health.
We'll be using a rapid self-test, but there are some other types of self-tests too.
You can buy a rapid self-test at your pharmacy or online.
Some health departments and community-based organizations also provide rapid self-tests free or at a reduced cost.
When using the rapid self-test, choose a time when you haven't drank, eaten, or used oral care products for at least 30 minutes and can wait at least 20 minutes for the results.
Ready to get started? We're gonna start by opening our box.
And it comes in this case.
And inside of this box, there is a lot of things. There's an instruction manual in English and Spanish. There is a drawer here at the bottom.
And in this little pocket, you're gonna pull out the HIV self-test stick and the HIV test tube.
Step 1 is removing the test tube and placing it in its designated holder.
The second step is you take out the test tube. Make sure you don't touch the end with your fingers. So you're pulling it out.
This is what the test stick looks like. And now just run the test stick on your upper gum. And now swipe it once across your lower gum. And that's it.
Step 4 is placing the test stick in this tube, head down first.
You're going to want to check your results between 20 and 40 minutes after you put the stick in the test tube.
I'm gonna hang out here, turn on some music. I'm gonna wait on my test and see what my result is.
So it has been 20 minutes since I took my test, and now it's time to check my results. There are 2 letters in the test stick.
There's a C and there's a T. If you have one line by the C, that means that your test is negative.
If there's a line next to the C and any line next to the T, even if it's very faint, your test result is positive and you may have HIV.
And if you see no lines or your test results don't look like any of the pictures included in your booklet, something may have gone wrong with your test and you need to start over with a new kit.
But it's not as simple as positive or negative. It can take up to 3 months for HIV antibodies to show up in your body at levels that the test can recognize.
So if you think that you might have been exposed within the past 3 months, it's really important to make sure to repeat the test.
And if your result came back positive, you'll need to follow up with a healthcare provider. Because if you have HIV, getting into care and starting treatment as soon as possible is very important.
Taking HIV medicine as prescribed can help you suppress the viral load in your blood, getting it to levels so low that by test standards is considered undetectable.
And that is the best thing that you can do for your health and for the health of your partners. The HIV rapid self-test is a great, very simple, easy way to find out your HIV status from wherever you are.
If your test result is negative, explore preventive options like condoms and PrEP.
And if your test result is positive, getting into care helps protect you and your partners.
Get tested. Together we can end the HIV epidemic.
What do you think of the video? I feel like that's such a, I just really like that video. Did you all like it, or are you going like, nah, it's just okay, or I've seen that before? And as if I understand correctly, that is the test that if you use the getmyhivtest.com, that would be very similar to the test that you would get using that site. Someone said to us, it helps sort of to normalize it. It's very simple. It's easier. And I sort of had that same response. Someone says they think it's a good video. It explains everything very well. It's simple terms. It wasn't just one type of person. It was very inclusive. And someone said, step by step, it doesn't get any better than this. I'm totally with you because I love things that are step by step. I wanted to point out and highlight, and again, this is just on the slide. It's just a screenshot. Yeah. Oh, I'm glad this video is getting a lot of love. Yeah. Some people are saying they thought it was a blood test and how could someone draw their own blood? I had the same thought. So PrEP sometimes is covered by insurance. Sometimes it's not. And I think that we all know this, right? We all encounter people that have different sort of access to things. So if someone already has a prescription for PrEP, so that would mean that they've seen a provider, they have a negative HIV test, they're going to see that provider again for those 3 months. And they're not able to, they don't have insurance that will cover PrEP. The Department of Health and Human Services does have this website that helps people identify and find out if they can qualify for free PrEP medications. So people already have to have a prescription with the medication name that they've been prescribed, but they could go to readysetprep.hiv.gov. There are so many resources on this website at readysetprep.hiv.gov. And again, you'll see this, it's on the slide, it's on the top of the slide if you download the materials. They have flyers, they have information in English and in Spanish, and it's all about PrEP and all about sort of normalizing that. So if we think about things in terms of we want to reduce the stigma around HIV, but we also want to increase people's knowledge and information and awareness around PrEP. That's really what this website is trying to get folks to do. And so there are, just as a caveat, if someone is seeking to get some to enroll in Ready Set Prep. There are like pharmacies that are sort of approved under the Department of Health and Human Services. They seem like they're pretty like large chain pharmacies. So, but you could go on, you could look and see what the pharmacies are and just see if they're available kind of like in your area. So again, this is for someone who wouldn't have insurance to cover the medication for PrEP, or it would be so cost prohibitive for it on their insurance. But it's a great website. And again, it has some resources for those of you that were saying like posters and brochures and information. It's a place where it's sort of a starting point. This website, which is also on hiv.gov, it's the HIV testing sites and care services locator. This is another resource that might be available to you to find out sort of what's available in your area. And again, you could show this and just kind of have information about this widely available, but being mindful of the fact that because we are, someone could, we want people to be able to weigh out those pros and those cons around like testing or seeking care or talking to somebody. So just having that as sort of a disclaimer, if you were giving this website out, that we want to be mindful of people's privacy. So those are options. And again, like they will be on your slide handouts. And if you need help or you find cool resources, please let me know, sending me an email. And I'm curious, as we are moving through this, we are almost done. I'm so grateful that you all have hung out with me this afternoon and talked about this topic that means a lot to me. I'm just wondering, do you have any thoughts about who could you partner with in your communities to talk about HIV and DV? I like that someone's saying SANE nurses, local hospitals, medical clinics. Keep them coming. I have some ideas, but you all usually have much better ideas than I do. Local colleges. I think that's great. Someone else says colleges, community clinics that are connected with the hospitals we're in. Absolutely. Schools that we're in, a free street medication doctors group in Lehigh Valley. That is really cool. Drug and alcohol services. Absolutely. Long-term care facilities, absolutely. Shelters, mental health facilities. Yeah, I think you all have landed on most of my potential suggestions, but I will go ahead and I always save chat from webinars because it's a place where I learn a lot more. So rehab facilities, definitely. So if you have ideas, keep dropping them in as we're talking. Here are a couple possible partners. So I know that a lot of you work for dual programs, but if you don't, if you're a standalone domestic violence program, reaching out and talking to the rape crisis centers in your county or that you work with, they really probably know a lot about PrEP and a lot about that. So reaching out and having some conversation about that, they also may be able to give you some information about places and providers who are pretty competent around talking about PEP and PrEP. You already mentioned this, substance use treatment programs, absolutely. And pharmacists, because they are really key people in our work. We have a medical advocacy pharmacy work group. I love talking about the role of pharmacists in supporting domestic violence survivors. And they're great folks that you can do some systems or policy advocacy with to find out like, hey, if someone needs PrEP, what's that process? If somebody comes in with a prescription for PrEP, what do you do? How does this work? Who gets that information? And it also gives you the opportunity to really develop some of those nice relationships with pharmacies, especially because I think during the pandemic, we've really, even more than ever, have realized how crucial they are. But they're also a place that most people use and see a lot more than they see their doctors. Just as a fun fact, people visit their pharmacy 12 times more than they do their primary care provider. And for a lot of folks where it's really hard to get to healthcare because transportation is not good, like something like 95% of people live within walking distance of one pharmacy. Other possible partners include the PA Department of Health. Wherever you are, they're great to reach out to and say, hey, tell me if somebody goes and they get an HIV test and it's positive, what happens with that information then? They're great people who may be able to come in and do some cross training with your organization to help you understand more about that sort of surveillance and the privacy and confidentiality, just to make sure that you're all on the same page. If you're in a place that has a local health department like Philadelphia County or Allegheny County, reaching out to them and having conversations is great. You may be in a county too that also has its own local health department. First responders, especially EMTs, they may have a lot of information about PEP that you could just say like, hey, tell me a little bit more. How does this work? And they're also great folks that can connect survivors to domestic violence programs, LGBTQ plus organizations sometimes. And again, you know, they're a group of people that we want to be aligned with, and we may already be working with LGBTQ plus organizations within your communities and your counties, but just finding out what can you both be doing to provide support if there's people living with HIV and people that are experiencing domestic violence. Sometimes they've been sort of siloed, and if we can find a way to merge and really create real intersectionality around our work, that's really important. Healthcare networks you mentioned, mental health providers, and also federally qualified health centers. Federally qualified health centers do tend to sometimes have like different and better access that they may be able to provide a little bit more information, especially around PrEP. So if you have other ideas that aren't on my possible partner list, or as a result of our time together today, you reach out to somebody, please keep me posted with what those interactions look like, because every time I do a webinar, I hope it's the start of a conversation, not the end of one. And my last thought before I open it up for questions, if there are any, World AIDS Day is always on December 1st. So if you aren't 100% sure exactly where to start, or you're like, wow, we're so close to the end of the year, I want to start working on maybe creating some space for people living with HIV, a great possibility to find some possible partners is maybe reaching out to one of those places that you were thinking of and dropped in the chat, or we just mentioned, and saying like, hey, let's collaborate on a press release, a social media campaign, a video, a something for World AIDS Day. Again, it's always December 1st. The 2021 theme in the United States is ending the HIV epidemic, equitable access, everyone's voice. Also, the United Kingdom has a campaign that I really like. This year's theme is Rock the Ribbon. So if you do hashtag Rock the Ribbon and you look at World AIDS Day in the UK, they have different celebrities who are wearing the red ribbons, explaining why they are wearing a red ribbon and whether they're a person living with HIV or they're an ally. And also in your copy of the PowerPoint, you'll just be able to click on some of these links. So really, you have a little bit of time. And again, this is a great way to start some collaboration, start some conversations. You know, maybe you would want to work and partner with someone and say, hey, let's do something on December 1st to raise awareness and start some conversations. So thank you for hanging out with me. I do want to ask, are there questions, concerns, thoughts? What would you like more information about? Or what are anybody thinking like, hey, I'm going to do something for World AIDS Day, or I'm going to reach out to a pharmacy? And while you are typing or thinking of questions, I genuinely want you all to know that my job is, I love my job, I love my work, and I'm so grateful for all of you. And if you have questions, if you have concerns, if you just want to talk a little bit, if you're like, hey, how do I start a conversation about this with a mental health provider? I'm here to help you, and I would love to hear from you. So you can email, call, but let me know what I can do to help you. And I just want to say thank you for your time, but also from the bottom of my heart, thank you for the work that you do. I think you're amazing. So thank you for your time. Oh, someone did say that they are planning to look into it more to bring awareness at local shelters. So thanks for that. If you need support around that, let me know. I will stick around in case there are other questions, but otherwise have a great rest of your day. Thank you for being here, and thank you for the work you do.